This afternoon in Roxbury, the mayor announced the new leader for the city's programs in substance abuse. The new Office of Recovery Services will be headed by Jennifer Tracy. She previously worked in substance abuse services for the State Department of Public Health. An agenda for the city's office was outlined in a new report from the Blue Cross Blue Shield Foundation.
We know that we have to secure more money. We know that. We know we have to secure more access to programs. We know that. We know all of those things. But we need to build pathways. We need to build pathways to help people recover. Or we need to build pathways and create pathways so we can prevent people from getting addicted in the first place.
Close to 10% of all Boston Hospital ER visits are substance abuse related. And roughly 5% of all inpatient admissions are substance abuse related. So we're talking about a major problem. Alcohol and heroin, unfortunately, are the drugs of choice for Bostonians. The rate of alcohol abuse is very high in Boston. 25% of Boston residents report binge drinking, and 10% report heavy drinking. The rate of unintentional heroin overdoses among Boston residents increased by 76% from 2010 to 2012.
What we're really going to work together to do is to bring together all the resources to better serve the city. So understanding how many beds do we have in our detox, reporting that information in, reporting in the bed capacity for our halfway houses to a centralized resource so that patients and clients can get to us more easily. What we really are trying to do together are break down some of the barriers to care.
The key here is to break down the silos of acute treatment, stabilization, recovery home, job training. It's to help people get a coordinator, a navigator, or a coach that will help them weave all those things together so that they can happen simultaneously to help them stay in recovery and to move forward in recovery.
To tell us about the blueprint for Boston's new Office of Recovery Services is the president of the Blue Cross Blue Shield Massachusetts Foundation. We'd like to welcome Audrey Shelto. Thank you very much for being with us, Audrey.
Thank you for having me.
You put this report together because the mayor wanted to set up the new office in the first place. And I guess the fundamental question here is, why do we need this agency that focuses on substance abuse?
Well, I think one of the findings that was most compelling in the report and the research that we did was that substance abuse services are provided by a wide variety of organizations in the city. And they're very good. They run very good programs, but some of them are city funded, some of them are state funded, some of them are private, some of them are public. And we really don't have a cohesive system of care for people with substance use disorders. So I think this office not being tied into any one particular department is probably going to be better positioned to do the kind of coordination and collaboration that's going to be necessary.
One thing I found a bit surprising in this report is the high percentage of emergency room visits that involve substance abuse.
Mm-hmm. Mm-hmm. Well, a lot of the visits have to, I know this anecdotally more than the data, because as you saw in the report, the data is pretty limited in terms of both use and capacity, but there are a lot of admissions related specifically to substance abuse, for detoxification or whatever, and then there are a lot of other conditions, falls and other things that are related to substance use that result in ER visits. Yeah.
Well, obviously, if you're overdosing, you have to go to the emergency room. But aside from that, what does that volume tell you about the way things are structured or organized?
Well, it tells me that there are probably other lower cost and more convenient options than an emergency room for a lot of people who are now using emergency rooms. So my sense is, with Narcan and other types of treatments that are now available to help people who are overdosing at home or in an ambulance or something, that there are initiatives underway and there are more opportunities to divert care out of expensive emergency rooms into more appropriate settings.
Your report also looked at what you call a capacity gap in Boston. Mm-hmm. How would you describe that?
So there was a pretty strong consensus among the advisory committee members that we do not have enough detox beds. So particularly the very high end where someone has a medical issue that either needs to be monitored or actually managed. They're running at full capacity now, and there was a strong sense that there's demand for more. Again, not a lot of great data, but a very strong sense that it's very hard to get access to those beds. And then there's also residential treatment beds where when people are moving down from detox into more treatment, lots of times individuals end up just dropping out of the system or falling through the cracks, if you will, because there are not those beds available. So the capacity of the city, interestingly, is actually not limited to city residents. So the capacity, the beds that are in the city of Boston are open to people from throughout the state, which again makes managing the system and coordinating the system pretty challenging.
The best known reason for the gap, of course, is the disruption caused by the closing of Long Island. But on the other hand, what else is causing this shortage?
Well, I would say the gap existed, the gap definitely existed before the closing of the bridge. That just exacerbated it because there were programs, obviously, on the island. But I think that you'd need to look at, and we did not look at reimbursement rates, siting issues. These are not, any program that's not in an inpatient facility is not easy to site in a community. And as I started with, reimbursement, I'm sure, is a challenge for many providers.
What I also picked up from the report is that there were inconsistencies in the quality of care. How do you think that should be addressed?
Well, what the Office of Recovery Services, what we're recommending is that, again, in a collaborative way, working with different types of providers and consumers, and academic institutions, that there really be almost a collaborative academy of sorts to disperse more information about evidence-based practices. What do we already know from the research works well in terms of treatment, effective treatment for people with substance use disorders. So our suggestion is to really, again, out of this office, try to pull together much more sort of training, education, and then monitoring to ensure that evidence-based practices are being followed.
Well, one thing that the mayor knew even before he got elected was that while he was a state rep, people were calling him to get into treatment. And, it was nice he was helping these people. On the other hand, should you have to call a state rep?
No, you absolutely shouldn't. And that was his point earlier this afternoon at his announcement. That absolutely should not be the case. And if you want a real, on the street sense of what the capacity gap is, there it is for many people in the past and currently. Since there are fewer beds than there is need, people who know people, are able to access beds easier than those that don't. And that is totally not acceptable to the mayor, and it's not acceptable in general.
The other end of this equation is prevention. Anything new you think the city should be doing with this? We
did not focus on prevention in this report, but I know that I'm sure the city is looking at new programs for the school systems, and a lot of the primary care sites are doing more screening. So while we didn't focus specifically on prevention, that has to be part of the whole equation and part of the continuum.
I guess the other thing too is that when people realize they have a problem and maybe they're still at the stage where they're reluctant to talk to somebody, what can be done about that?
Well, one of the things that many states and cities have found effective is using much more of non-traditional providers. So using peer coaches, using someone who's got experience with addiction themselves, who isn't, a master's degree clinician or someone, but is there really and can say, I've been in your place, I know where you're coming from, and understands that reluctance to seek treatment, even if you're beginning to feel like you have a problem. So I think the use of peer counselors, recovery coaches, there are other programs that are run by people with experience themselves in substance use disorders and addictions, so it makes it a little more approachable and a little less intimidating for people.
Thank you very much for being with us.
Thank you very much.
Audrey Shelto from the Blue Cross Blue Shield Massachusetts Foundation. We'll have more news in just a moment.